I was having shoulder pain that was getting progressively worse. It was waking me up 2 or 3 times per night, or 4 or 5 times per night, and I began to lose range of motion and strength, and I consulted Dr. Smith.
Mr. Gatlin came to us with a pretty common problem, and that's shoulder pain that starts after activities. But what we sometimes find is that, you know, it's not just the activity that brought on the pain, it's long-term issues. And when we first saw his x-rays, you know, we knew that really he had end-stage arthritis. We try to treat these things non-operatively, and if that fails, you know, those patients become a candidate for total shoulder. Now, Scott's a great candidate for, you know, some other cutting-edge things, and you know, with his young age and high activity level, there's some exciting things with shoulder replacement that he became a candidate for. Number one is the metal peg glenoid. The glenoid is the socket. The metal peg is an area in this replacement socket that allows it to grow into the bone. With the metal peg, we think is going to allow patients to keep that component for as long as possible. You know, the long-term issues with shoulder replacements has always been glenoid loosening, and the glenoid loosening that we're seeing with this current implant is extremely low. The other innovative thing that Mr. Gatlin was a candidate for was potentially doing this as an outpatient. That's a new concept with joint replacement to try to get folks out of the hospital as quickly as possible.
We did that surgery at 6 o'clock that morning, and I was in my recliner by 5 that afternoon, and that was the best place for me.
When Scott came to see me, his elevation was really probably about to here. His elbow would not even quite go over his shoulder level. His external rotation, you know, it was basically straight ahead. You know, I call it the gunslinger position because they really can't go past this amount. And now, you know, Scott can kind of show you. I mean, he has normal or near normal motion, and his rotation outward also is really just spectacular. So this is what, you know, we hope for. He's, you know, clearly in the top 5 to 10% of all the shoulder replacements. And you know, I think that his diligence after surgery is a part of that, and I think that his commitment to the therapy is clearly influential in that also.
I think the thing that surprised me the most, and I'd had other orthopedic surgeries before, but this one, there was no post-operative pain with combination of the different pain control techniques.
Shoulder replacement is a great option for those patients, you know, just to be able to live what we would consider to be a normal life, where we can just go to sleep at night and be able to stay asleep and not wake up with miserable shoulder pain.
I can't say enough good things about the post-operative care and the day of surgery. I just felt like I was in the best of hands.